On the evening of July 11, 2026, Republican Senator Lindsey Graham passed away from something called an aortic dissection. He's not the only famous person this has happened to. Back in 2003, the actor John Ritter, the dad from the TV show 8 Simple Rules, died from the same thing at just 54 years old. Doctors first thought he was having a heart attack, but it was actually something more dangerous. So, what is aortic dissection? Why is it so deadly? And how can you protect yourself and the people you love? Let's break it all down in a way that's easy to understand. Think of your heart like a pump. Every time it beats, it pushes blood out through a big tube called the aorta. The aorta is the biggest blood vessel in your whole body. It carries blood from your heart to your brain, your stomach, your kidneys, your legs, everywhere. Now, the wall of the aorta is made up of 3 layers, kind of like a garden hose with 3 coats. The inside layer, the middle layer, and the outside layer. All 3 layers work together to keep the blood flowing safely. In an aortic dissection, a tear happens in the inside layer of the aorta. Blood rushes into that tear and starts to split the wall apart, like peeling apart the layers of cardboard. This creates a second tunnel inside the wall where blood is not supposed to go. This is a huge problem. That second tunnel can block blood from getting to important parts of your body like your brain, your kidneys, or your legs. If the tear gets bad enough, the aorta can burst open, and that can cause death within minutes. There are 2 types of aortic dissection, type A and type B. Type A is when the tear is in the part of the aorta closest to the heart. This is the most dangerous kind. Without treatment, about half of people with type A can die within few hours to 2 days. Type B is when the tear is farther away from the heart in the lower part of the aorta. It's still serious, but not always as immediately deadly. So why does the aortic dissection happen? Why would such a strong blood vessel such as aorta suddenly dissect or tear? The number one reason is high blood pressure. Imagine blowing air into a balloon. If the pressure stays high day after day after day, the balloon pops. The same goes for the aorta. Elevated blood pressure puts stress on the walls of the aorta for years. You don't feel it, you don't hear it, but the damage keeps building. And one day, the aorta dissects and tears. That is why the high blood pressure is often called the silent killer. And here's something scary. More than 2 out of 3 people who get an aortic dissection have high blood pressure. So if your doctor tells you your blood pressure is high, don't say, I feel fine. High blood pressure doesn't care how you feel, it only cares how hard it's pushing. And who else is at risk for aortic dissection? Some people are born with weaker blood vessels. These include patients with Marfan syndrome, Loeys-Dietz syndrome, or Ehlers-Danlos syndrome. If these names sound like Harry Potter spells, you are not alone. The important thing here to remember is that these conditions can make your aorta weaker and stretch and tear more easily. Other things that increases the risk of aortic dissection include smoking, very heavy weightlifting, major car accidents, pregnancy, and sometimes stimulant drugs like cocaine. And here's one many people forget: family history. If your mom or dad or brother or sister had an enlarged aorta or an aortic dissection, tell your doctor. That one conversation could save your life. Now let's talk about the warning symptoms and signs. The most common symptom is sudden severe chest pain, not the pain that slowly builds over hours. This pain hits like lightning. Many patients say it was the worst pain of their life. Some describe it as tearing. Some say it was ripping. The pain can travel sometimes to their neck or to their back. Other warning signs include feeling faint, passing out, trouble breathing, sudden weakness on one side of the body like a stroke, cold, painful, or numbness in their legs. And here's the tricky part. Sometimes there is almost no pain at all. Not every chest pain is a heart attack. Here is a question. If someone rushes into the ER holding their chest, what is the first thing you think? Most people think it is a heart attack, and that is a good guess. But doctors have to think much bigger because there are 5 deadly emergencies that can all look similar. Think of them as big 5. Number 1, heart attack. Number 2, aortic dissection. Number 3, a blood clot in the lungs. Number 4, a collapsed lung under pressure. And number 5, a tear in the foot pipe. And here's the scary part. An aortic dissection can almost exactly look like a heart attack. And sometimes it can even cause a heart attack. That's why doctors often order a special CT scan called CT angiogram. It lets us see the aorta and find the real problem before it's too late. So here's today's biggest lesson. Never ignore sudden severe chest pain. Don't Google it. Don't try to wait it out. Call 911 immediately. Every minute matters. In the next section, I'll show you something most people don't know. Did you know doctors can sometimes prevent an aortic dissection before it ever happens? Here's some good news. Most people do not need to worry about getting screened for aortic dissection, but some people should absolutely be screened. If you have Marfan syndrome or Loeys-Dietz syndrome or Ehlers-Danlos syndrome, or a bicuspid aortic valve, your doctor may recommend regular scans of your aorta. And if your parent or your brother or sister or child had an enlarged aorta or an aortic dissection, you should tell your doctor because sometimes these conditions run in families. Finding a problem early can literally save your life. Most people think surgery happens after their aorta tears. But here's something amazing. Sometimes doctors can fix the problem before it becomes an emergency. Imagine you notice a crack in your house wall. Would you repair it today or wait until the whole wall collapses? Exactly. Doctors think the same way. If the aorta becomes swollen, it's called an aortic aneurysm. If it grows too large, the chance of tearing goes up. So for most people, when the main part of the aorta reaches about 5.5 centimeter, planned surgery is usually recommended. For some people with inherited conditions like Marfan syndrome or bicuspid aortic valve, surgery is done even earlier, such as at 5 centimeters, because their aorta is more fragile. The damaged part is replaced with a strong artificial tube called a graft. Think of it as replacing a weak section of an old garden hose before it burst. And here's the important part. A planned surgery is much safer than rushing into emergency surgery after the aorta tears. That is why regular checkups matter. So the bottom line, the good news, aortic dissection is rare. The bad news, when it happens, every minute counts. So here's what I want you to remember. Control your blood pressure. Don't smoke. Know your family history. If your dad or mom or brother or sister or your child had an enlarged aorta or aortic dissection, talk to your doctor. If your doctor says your aorta is enlarged, don't skip your follow-up scans. And most importantly, if you ever have sudden severe chest pain or back pain that feels like the worst pain of your life, call 911 immediately. Don't drive yourself. Don't wait until morning. Time can be the difference between life and death. If this video taught you something new, please like this video and subscribe to Dr. Logic 360 and share it with your family, because one share could one day help someone recognize the warning signs and save a life. I'll see you in the next video. This is Dr. Joseph Gnanaraj signing off.